In this video, we'll be talking to Dr. Kaiser. She is a clinic owner, and we're going to learn from her. We could talk about marketing, operation, and how you found the clinic. Tell us, we want to know.
Absolutely. First question, how I found the clinic. All right, this is probably the most interesting part. I was living in Texas, and I wanted to return back to Florida after we had the fall of the whole economy in 2008, 2009. And around 2012, I thought, okay, Florida's kind of leveled out. I could probably come back. And one night I was just looking at all different resources and looked online, and just there was a one-line ad that just said vet clinic for sale, Jacksonville, with the phone number.
What website did you find that in?
No, can't even remember. Like, it was so random. I think it was maybe Godsend or something like that, because I had no idea. Yeah, it was the most fortunate, luckiest thing that's ever happened. Yeah.
You know, I always hear from vets, they're like, it's risky starting a business. Yes. If you start a business, you could go bankrupt. And what I think is like, a job is just as risky, because you can lose a job any day.
They can let you go anytime.
Yep. Yeah. I mean, a lot of people have fears about starting a business. I think that it's just like a job. It's just like your career in veterinary medicine. It's just like being a mother. It's just like owning a house. You know, you just get up every single day, put one foot in front of the other, and that is the baseline. You have to do that. And if you continue to do that, you're never going to fail. You might have peaks and valleys,
bumps in the road,
but you're not going to fail, because even if you do fail, you're going to get up the next day and you're going to keep going. So I think that's the biggest thing, is the tenacity.
That takes a lot of courage, though. So you found a clinic in Florida, and you're like, let me get on a plane and go buy this clinic.
I did. And I was a single mom at the time with my 6-year-old daughter, and I actually drove the 17 hours.
Oh, and you drove.
I came and I looked at the clinic, and the gentleman that had it for sale, it was a little embarrassing, because when I first met him, he pulled up in his, I think he had a Trans Am or something like that.
Oh, cool.
And I said, oh, that's a really cute car, to the 60-year-old veterinarian gentleman. And he goes, it's not cute, it's handsome. And I was like, oh no, this is not going to go well. And met him, and I stepped in the doors of the clinic, and I kind of panicked for a second, and my foot started to go back out the door, thinking, no. And then I said, no, like, go in, keep going, figure it out as you go along. Yeah.
That's good. You controlled your fear, your emotions.
I did. Yeah.
You didn't let fear overcome the tenacity to pursue dreams.
Just keep pushing forward, you know?
Did that guy have a mullet? He was back in the 80s?
No,
oh my gosh.
He is actually
it's like a Camaro, this guy. Trans Am.
Yeah, no.
I kind of got a mullet. Did you see?
Keep working on it. Keep working on it.
He's actually a wonderful veterinarian from our local area. Great guy. He had gotten out of the industry due to some health issues, and his wife was running the clinic, and she was a wonderful person to work with the transition.
Awesome.
Yeah.
All right, let's talk money now.
Yes.
How'd you buy your work? How'd you finance it?
So how did I finance it? It depends on the type of clinic that you're going after. I had originally looked at doing start from scratch, build your own
brick and mortar type of thing.
Mortar kind of thing. And I discovered for me that was going to be a lot more expensive. And I kind of looked at the price range I wanted to spend, and I thought, oh, let me see if I can find a clinic that's already up and running, so you can have income right away. And so I found a clinic that wanted to have a transfer to a new owner. And I think I looked into a few different banks and a few different routes, but Bank of America has a pretty good solution for people that want to start or buy new practices. And they have a whole setup streamlined to just kind of walk you through the process. So I literally went in there with no knowledge and just followed, again, one foot after another, and just followed their lead. And you have to stay on top of things, but their plan for veterinarians is very helpful, and I would recommend it very much. Mm-hmm.
They must have done some sort of valuation. How does that work when you evaluate the business?
Yeah, so I had to provide to them a copy of the records, so the profitability and the profit and loss statement and whatever other kind of documents they requested, which I had gotten from the business owner, and I provided them. And then they gave a valuation for the business. And because it was a small practice, and because the owner had been sick, the value was more just in the equipment for the most part, and the building, not so much Goodwill. So I think it was a little easier for them to value. And based on that, they were able to come up with a his offer price versus what the bank would loan me, and then a little bit of capital to run with. And that's how I kind of figured it that way.
Did you ever encounter another business owner that financed different ways or alternative financing?
Yeah. Yep. So definitely there's ways where a practice owner can finance and help you along. Some family members will contribute. I've even seen some novel ways where a practice owner that might be retiring and maybe doesn't have a huge practice with a lot of value, but doesn't want to close the doors, and they'll actually do type of like a lottery where veterinary students, they'll pitch it to different veterinary students, and they can pay like $125 for like a coupon, a ticket, and they could actually win the clinic. So these are for lower value clinics for maybe an older doctor that
just looking to retire,
hasn't grown a big behemoth of a practice, but also has value and doesn't want to close it. And so that's kind of an interesting way to go forward too. It's a little bit more creative.
Yeah.
Because I've heard in Jacksonville, some vets have just closed the door and walked away.
It's very common, unfortunately, in this time that single doctor practitioners are few and far between. But less common is people that are graduating that want to be a single doctor or a solo practice. So those are the people that are having the most difficult time. Myself, I think it's actually a great adventure for the two to join into. The problem is, how do they meet one another? I've talked a lot about starting a group to help new graduates or veterinarians to join with practice owners that are closing. And this is not the traditional route of somebody that's going to go in and build a $2 million practice and that kind of thing. There's some people that just don't want to have a 5-doctor practice. They want to have more of a small town, one doctor, the patients, they know you have a good life. Also like a veritable small town, even if you're in a big city.
Awesome. So what were some of the setbacks that you faced during the purchasing process, maybe with Bank of America or other doctors that faced some setbacks, say, when they were going through this process? Is there any regrets, any bad advice that was given?
It's a good question. I didn't have any setbacks personally because I wasn't going for a high value clinic. I think if it was a $1 million or $2 million clinic, that might have been a lot trickier.
Different.
Mine, I was fortunate. It was primarily a handshake deal with the owner. We did have to have a lawyer to work with us and bankers, but I didn't have any hiccups. Mine went very smoothly and transitioned really easily. I think the only hiccup I had was when we transitioned. I wanted to be clear about what the current practice owner was taking, because we did have product and that type of stuff and equipment. And so when I asked him what he was taking, he said nothing. And I said, and I looked and I said, well, you've been here for 25 years. You must be taking something. And he said, no. And I looked over to the corner to the 2 ferrets that were in the cage. And I said, well, obviously you're taking the ferrets. And he said, no. And then I became the proud new owner of 2 ferrets. Yeah. So I would say, honestly.
Did he leave the Trans Am?
No, he kept his Trans Am.
Okay.
I did not get a Trans Am. Nope. I did get his wife for a short period of time for the transition.
He gave you his wife?
She helped for about a month for the transition, and she was really sweet. But
he went and got a new wife too?
Yeah, no, he has a great wife, so he didn't want to do that, no. But yeah, so the only downside I had was the ferrets. Yeah.
I agree with you in the sense, for example, when you work at a corporate clinic, there's always an administrator, and you have to see what comes in the door. And many times there's clients, that feeling like, oh my God, it's that guy again.
Yep.
He's problematic and everything's expensive and insulting. Once you own your own practice, you get to work with who you like.
Yep.
You get to do what you like. So you kind of steer your career where you want to go. You have autonomy.
You have autonomy. You can be a better version of yourself because you're not choosing to take on situations that that you might not operate that well in. And so you can design it to the way that you like, and it also then garners a clientele that also likes you to work that way. And obviously people who don't like that will go elsewhere instead of kind of being forced to do everything, see everything. A good example, I did time, which is a large corporate, and we were forced to see exotics. And I don't have any experience in exotics. And I felt it was unfair to the clients to advertise that you have veterinarians And a lot of veterinarians don't see exotics. That's not uncommon, but not, what kind of market that they do. And I would tell clients as soon as they came through the door, like, hey, I will see your bearded dragon. I will see, but I'm going to tell you up front that I am not the expert in
In the
this.
delivery.
I'm not
So your particular practice, how do you schedule your appointments? How do you schedule surgeries if you do those? And I know personally you are a big fan of pet insurance and have pet insurance on your own pets.
Yeah.
So can you just talk to our viewers a little bit about the integration of pet insurance and how you schedule, you were talking about how you can make things your way to make sure your clients, like, how do you operate, and maybe what experiences you've had at other places, how they've operated?
Yeah, absolutely. And this probably wraps also into the question of, why did you decide to become an owner yourself? So when I worked for other practices, I would repeatedly get into the same situation with the same problems at different practices. I did some relief, and I worked for the military, and I did work for ER, and I did corporate practice, private practices, but there seemed to be a lot of similar problems that kept happening. And they all added up to the same thing. They added up to a disgruntled client that would then be upset with you, even if you gave 100% and did everything that you could, because the foundation wasn't stable for what you could offer and what they expected. There's always this
a gap.
A gap.
Yeah.
And it was a lot to go to work and to come and show up and want to do everything and provide everything, but have certain things that always would get in the way. And an example of this would be patients waiting. So very simply, when I opened my practice, I was like, what do I want to have different?
Mm-hmm.
No one likes to wait.
Mm.
No matter how good of a veterinarian I am, if people wait, they start to become dissatisfied, and that can bleed into the appointment. And humans are humans. I can get that way sometimes in situations. So in my practice, I make sure no one waits. Okay, how do you do that? I schedule my clients 1 hour per pet versus most practices 15 minutes per pet. This allows me to be able to stay on time and to be thorough.
Awesome.
Yeah, I worked for a corporate clinic too, similar to yours, and it was like that.
Might have started with a B. I don't know.
They were focused a lot on business.
Yes.
And what they did was two things. They wanted you to see more pets, and they wanted you to charge more.
Yeah.
So you had your APC.
Yep.
And what they were always trying to do, because when these administrators and business people get in, they kind of focus more on, like, how can we produce more? How can we get more?
Yeah.
And this is the thing that we were talking about. They were trying to shove the mid-level practitioners down our throat. And that's one of the things that they really want. They want the doctor to sign and somebody else to be in the clinics doing more,
And in one way, like, people think that, oh, maybe that's what they want if it brings down the cost of services. And from the corporate's perspective, oh, if we could see more,
increases revenue.
But in actuality, what's going to happen is you're going to have someone with less experience, less knowledge, treating a patient with a client's expectations still being the same. And the outcome is going to be beneath what we already have, not in every situation, but in a lot of situations. That's my personal opinion. I think my practice is different insofar as I spend the whole hour with my client. I don't send a technician in, I don't send a receptionist in. I go and I talk to my client. I find out what's going on. So we're not playing the telephone game.
Because I did an interview on one of those Trupanion reps, and what she explained to me is you want the animal to be young and healthy, and they give you the first month free. So, in Trupanion.
This is important. That is, every business has their focus.
Yeah.
Trupanion focuses on getting young, healthy animals. Obviously, they know where they make the most money, but I've been a practitioner for almost 25 years. I've been using Trupanion insurance for almost a decade and a half.
Wow.
And I can tell you that every single pet that is under the age, I believe it's 14, pretty confident 13, 14, I have to look that up. Under that age, unless they have a condition that they are currently dying from, they would benefit from insurance. And I have many cases where I can show people where a 10-year-old dog got insurance, and he might have 5 pages of items that are not covered because they're pre-existing, which is okay. And still they have an excellent experience. So having used it so much, I processed over $2 million worth of claims personally myself.
Wow.
I really know how it works. I know how it benefits the pets. And I do disagree with Trupanion because their goal is to get as many pets covered and to make much money as possible. My goal is to make sure my patients have care when they need it. And who needs more care, a 10-year-old dog or a 2-year-old dog? Almost always a 10-year-old dog. You know, chronic diseases, getting older, things starting to fail. Yes, a younger dog might, you know, break a leg one time or
Mm-hmm.
little vomit and diarrhea here, but they don't have as frequent, not everybody, but the sequential, you know, as you get older, just kind of, as we know, keeps a little bit more, a little bit more, a little bit more. So it's really important to have insurance for all ages of dogs. It's always beneficial, but don't ever not get it because they're too old unless they've reached that cutoff. But before that, I guarantee it will work.
So you figured it out that the animal comes to your clinic, you treat them, and they just pay like a deductible or a co-insurance.
Yeah,
You charge the insurance the rest.
Yeah, it's super simple. So let's say you came to me and you had pet insurance already on your pet with Trupanion. You would come into me, we'd do a normal talk, exam, discussion. I'd make an estimate for what needs to be done. They're the only company actually in North America where I can actually take that estimate, put it into the computer software, which is right at my desk with the client, and I can get a pre-authorization, usually within less than 5 minutes,
Wow,
which will tell us exactly what they will and will not cover before we go any further. The next step, when we decide to go further and do A, B, C, and D, then at the end of the visit, I can once again go into the software within literally 60 seconds, submit that invoice. And for the vast majority of clients, I would say 95%, we have a decision within 5 minutes before the client leaves the room. They pay their portion, and then the client is responsible for their portion, which would be the deductible that they choose, and then the co-insurance, which is only 10%. So it's quick, it's simple, it's easy, and a kind of a hidden or secret benefit that's not a secret anymore is that I manage, for example, all the Trupanion insurance for my clients. So they don't have to pay up front, then go home, take the receipt, submit it online somewhere, and wait to get paid back. It is just done instantaneously. And if there's an error because they're paying me directly, I'm going to handle the error because I'm the one not getting paid.
Right.
I would do it anyways for them, but obviously there's a reason for me to do it. So I do all the legwork, saves clients a lot of money, and it gives them unlimited capacity to have their pets cared for.
That's a great idea.
That's awesome. Do you have experience with any other pet insurance? Just because I know, like, I went to VMX this year, which is a big conference in Orlando, and gosh, there was like lemonade insurance, pumpkin insurance, ASPCA.
Yeah.
I personally had Trupanion. Yeah.
They're all like food.
Yeah.
I personally had Trupanion, but my brother has lemonade insurance on his dog.
Yeah.
And so I was just curious if you had any experience with like other ones compared.
Yes. So I'm going to make it really, really simple. All other ones, 2 thumbs down. But it's for legitimate reasons.
We should get sponsorship.
We are not getting paid by Trupanion, by the way.
We're not at all. But if I took an oath to be an advocate for a pet, and every single other insurance company, every single one, you have to come to the vet, you have to pay the bill, then you have to upload your receipt and wait to get paid back. The problem with that is that in the moment that you're paying, you technically don't have insurance because you're paying. And so that causes a client to look at the invoice and make financial decisions instead of medical decisions. When the insurance company is paying directly, you're not making financial decisions, you're making medical decisions. And here's where it's most important. A client comes to me and they have insurance and their pet is sick. They're with me for the day. At the end of the day, I bring them in to discharge and say, hey, this pet is worse than we thought it was based on everything we have back. A, here's your bill, which you know in advance because we talked about it. But B, you have to go to the ER or a specialty hospital because there is more that has to be done. Like, this is not the end of the case. If you have any other insurance other than Trupanion, you have to pay that invoice now. Let's say that was $1,500 with me today. Now you fly off to the ER or to the specialty hospital, the orthopedist or whatever, and let's just say it's this night, you have to go right now. They always ask me, well, how much is the ER going to be?
Mhm.
I don't know, but I'm going to guesstimate probably starting at 1,000 and up,
Mhm.
to be fair. And so now this person that has insurance just paid me $1,500 and knows they have an unknown amount tonight and an unknown amount tomorrow morning. And how long does it take for that person's pocketbook to be empty? You don't know.
Right.
Did they buy a house yesterday? Did the kid just go to college? Did they just get a new car? Did they just have an accident? Did they just get a tooth filling? So even people with some decent wealth could be in a position where that money is not accessible, or frankly, they don't want to spend it.
Right.
If you have Trupanion insurance and they paid me directly, and you just had to pay your deductible, the most common is $250, and then 10% of the bill. So they know the condition's covered. They only had to pay that part. And now if they're headed to the ER, that also takes the coverage. They know it's going to be covered there too. And they only have to pay their exam fee and 10% of the bill because the deductibles are covered. So the two positions are drastically different. Trupanion is the only one that pays directly and the only one that can do pre-authorizations. Everybody else, you actually don't have the insurance until you get that money back in your pocket, which could be days to weeks later. And in an emergency, that's not helpful.
Right.
I think for most people.
Mm-hmm. So kind of back to being a business owner, currently we're dealing with kind of this plethora of online pharmacies with and now even some telemedicine type stuff, like which we had a podcast about that before. You should watch it. So how do you manage challenges from these online pharmacies or telemedicine, and even comparing corporate clinics? Like, what is your approach as an owner, and what would you like other business owners or potential aspiring business owners to know about how you can handle these large corporate online pharmacies that are bleeding us small private practitioners dry as far as cost stuff?
Yeah. So I made a decision 15 years ago when it started to become a thing where people wanted to get their prescriptions at other pharmacies that I didn't think it was beneficial for a couple of reasons. One, you go to another pharmacy, you get your prescription, we lose all track of that. When we're trying to figure out if your pet's better or not better, we're trying to figure out how many doses you gave, look at compliance, we have no information. So no information about what's been given, which really helps guide us in diagnosing and treating. Also, the ability for us to give the first dose in the room is often very important to get the dog started. Lastly, people are very, very busy. The last thing you want to do when you leave the vet hospital is now go to another pharmacy, wait hours or days or whatever, or even if you're getting it online, it doesn't come in a second.
Right.
So clearly for the pet, in their best interest is to have the medicine immediately. I think that's pretty understandable. But there's always the concern about price. Some of the online places can be cheaper. But I don't have that concern because I still have my pharmacy and 90% of my clients have insurance. So when I say you need X, Y, or Z, and it's going to be covered at the time of service, and it's going to be paid for directly, and it's going to be given to the pet in the room, and they get to take it right away, they would never even question about going to another pharmacy. They're not looking to try to save money. It's already covered by their insurance, and they're looking for convenience, and they're looking for a quick remedy, and they're looking for their pet to improve as quick as possible. So focusing on insurance that pays at the time of service eliminates even the concept. No one even asked me about an online script for something because it would be nonsensical.
So I have, as a relief vet, now I've been going to many different clinics and I've seen how different private practice owners handle these online prescriptions. Some places will not accept requests from. They say if you want to use this pharmacy, you can pick up a written prescription and you can mail it or fax it or do whatever, but we're not answering emails, we're not doing this. Other clinics will say, if we carry the medicine in the clinic and you want to order it from a third party, we're charging you a $5 prescription fee.
Or more.
Or more, $5 to $10. Yeah. And that often sometimes will end up either leveling out the price or it causes more hassle for the clients. So what is your opinion on some of these tactics for private practices? And do you think that it's a good policy? Do you think it's fair? Because personally, I think it's 100% acceptable. So.
Yes. So I do that. So for my clients that don't have insurance, and it's very few, but for the few that haven't jumped on insurance and they're trying to keep their costs down, they want to get it online, I do require them to get a prescription from me, and I do charge a fee. And here's the reason. When we have medications that are being given to a patient, they have to be looked at by a pharmacist. And in our hospital, we are pharmacists. We're the only business, we're the only group of practitioners that have our own pharmacy aside from pharmacists. Human doctors don't have their pharmacy.
Yeah.
We have our own pharmacy. So I act as my own pharmacist, right? And when you go to the pharmacy, nothing goes out the door without the pharmacy checking it. And I believe in a veterinarian's hospital, nothing should go out the door without the veterinarian checking it, because you don't want to have errors and mistakes. And clearly, our education and our training and our experience is a lot higher than maybe somebody that's worked there for even a few years. It's just not comparable. So it should be our due diligence, just like a pharmacist would never allow a product to go out by the person handling the till or the assistant. If we do that, it takes our time to look into the record, to look and see what's been done, to look and see if it's appropriate, to look and check, review their blood work or whatever we need to do to make sure this prescription is correct. They're asking the doctor, can I have this again? And that should not be determined by somebody sitting at a register or at a computer that doesn't have the appropriate training to do that. So it does take time for a doctor to do that correctly and to lower mistakes. And there should be a fee for that. And my own human personal doctor that I go to for the last 12 years, GP, they have signs all over the office. They say refills for prescriptions will not be filled outside of an appointment.
Wow.
And that's been for over a decade.
I think we spoke about this before, and this goes into lawyers. Lawyers charge you. If a lawyer calls you, they charge you. If they think about the case, they charge you. If the paralegal works, and I know it's because my wife's a lawyer, so she spends all day arguing with people for money, and then she comes home and argues with me for free.
That's his favorite line.
I'm getting better, though. I'm getting better. It's good to argue with a professional.
Yes, that's right.
But it's like, if you go to an accountant, you know, they charge for the time. Right. Lawyer charges for the time. But when you go to a doctor, they expect, everything has to be for free. But you have an operation. Your time is limited. You only have so much time. And then when you request something, it's only obvious that you're going to charge.
Our pharmacies, most people's pharmacies used to make up a significant portion of the income to the hospital. If you forgo that, then you're going to have to generate that revenue in a different way, because you still have the expenses, your time, your overhead, your staff, your taxes, your licensing, your continuing education. I mean, it goes, as a business owner, it goes on and on and on and on. And so if we can't sell the prescription to you and make the profit off of that, and if it's going to go through some online source, etc., then two things are going to happen. Either we have to increase our price for the exam fee and all of our services, or we charge a fee for the script. Right now, charging a fee for the script is very minimal, and it doesn't really make up for it at all. But I think it also gives you a chance to talk to the owner and make recommendations.
What I heard is vets are losing 10 to 20% from them going to these other sources.
I think it's actually significantly higher.
Oh, it's higher than that?
Significantly higher,
Wow.
So we have to make it up some other way. But the problem is also these corporations, they use a lot of psychology. What I've noticed, so for example, if your animal passed away, they send you flowers. Or they might send you free things. The first transaction is actually, I think they sell it at cost. So they hook you. They're like, oh, it's so affordable, the first one. But it's not that way. Then they jack up your prices. But what I tell some clients is like, who do you know in that corporation?
Nobody.
Can you invite that person to your house?
Right.
You don't know, they're strangers. It's mostly computer programs that do these things.
Most of my clients have my cell phone. And so I get texts. I mean, I went to a client's house on Christmas Day and I euthanized their dog because it had been sick and they had been ER. And they called me and they said, hey, I know it's Christmas Day. We're very upset. It's time. Could you come? And I went to their house and I did it. I think that they're just a big corporation. No one knows you. They send you flowers. They don't know you. They write you a nice little card. They don't know
It's
you.
an auto-generated
How
card.
many
By the
flowers
way.
do they send? It's just, oh, the
Yeah.
dog died. Let me send them
Right.
flowers.
We
Let me send them flowers.
Yeah.
Like,
Yeah.
We hand sign every single
Yeah.
card that goes through our offices for people who've lost a pet.
Yeah. And if and I also tell my clients, you buy the product from me, aside from the fact I can give them the first dose, I can show you how to administer. If you're at home and the dog throws up the dose or won't take the dose, or if you have issues, you can call me. I can help you. I can provide you new product. I can change the product. Or if you've gotten that medication and you've had it for 2 days and this is not working and we have to change course, I can rapidly get you on a new product instead of you going through the whole process and get an email. How long is it going to take this dog to get better, this cat to get better? Are they going to get worse in the meantime? What about these products sitting in mailbox and reaching temperatures of who knows what?
right. Because
Yes.
you don't know how it's stored.
No,
You don't know if
crazy.
now it's like 100 degrees now in the
Yeah.
summer. So
Yeah, or in the winter if it freezes.
it
So
freezes.
it
Yes.
it doesn't seem to be in the best interest of the pet. And how I know it's different is when my clients come to me and they have insurance that pays at the time of service. It's the closest thing we can do to make it free. It's not free, but as close to being free as possible. And guess what? Everybody says yes. And they, please give the medicine, please administer it, please show us how to do it. I even tell them how it tastes, so I can tell them why the dog's going to react this way and give them little tricks.
Yeah.
Yeah.
So I do know a lot of business owners are trying and are doing well with their own personal online pharmacies. That people can order those medicines online, and the prices are very comparable to these larger pharmacies. But you're still going through us. Some clinics it will auto transmit to their and then it'll also show evidence on Avermark or on EasyVet saying, "Hey, purchased HeartGuard 6 months," and so you know exactly where they got it, and it's a small smidgen of a profit for the clinic that you're buying it from, a little bit, like 5% or something, I think is what I've heard. Do you utilize that type of service, or?
I don't know. I do not.
Okay.
Look, part of this conversation is about business, so this might be interesting just to business people purely. It doesn't make any sense to farm out one of your areas of profit for your business. Pharmacies used to make up 30 to 40% of the profit of a veterinary clinic.
That's a lot.
Not saying I should say gross income, not profit, obviously. Gross income. So why would you give that to another business? A lawyer, a doctor, a dentist, they're not giving their business to someone else.
No.
And I also say, what is the need for clients to be ordering their ordering their medication online? What is the need for it? Animals are supposed to see their doctor twice a year. When you come in, you purchase your heart and flea prevention for 6 months. There's not very many things that you do need to get online, right? Something that I do hope that happens in the near future, because there is some accessibility, some older people, or what if you're sick, or what if you're traveling and you just couldn't make it in. I do understand there's certain situations that the convenience is there. I'm hoping in the near future to be able to have Tesla and to be able to send out my products and get them delivered to people's house. So instead of, again, ordering online where you have to wait for it to be shipped, and that could be 2 or 3 days or who knows how long, right? To be able to be like, hey, yes, we can get it from my pharmacy, but get it to you today. So the online pharmacies are there. They were generated not by us, but they were generated by companies who were trying to take our business.
Right.
And they convinced a lot of veterinarians that it was a good idea to outsource their business to them so that now we can only make 5%. It makes no sense from a business perspective. Yeah. But again, you do have to do something to make sure you can keep it affordable, which I use through insurance, and keep it accessible. And there's various ways to do that, but try to be very effective when people come in and don't have them go home and call 3 days later and, hey, you forgot to give me this stuff.
Right.
And now they're making their own clinics, so they're becoming competitors now. And they have a big database.
You don't have to worry about it. They're not competitors.
No.
A competitor is somebody who can equally provide what you provide. In business, you want to differentiate yourself. Like anybody says, if you want to be good at something, differentiate yourself. Do something different than everybody else is doing. All these corporations are doing the same thing, and it's just numbers. You want to be a good doctor that listens to people, that stays on time, that gives people time, that is respectful, respects them, respects their patient, and has a true interest in making their pet better. That will differentiate you from the quote unquote competitors, such that the other ones are not even competitors. And that's not saying that the veterinarians working for them are bad. I do not believe they are. It's the organization that is just focused solely on money, and it's kind of a bait and switch. You're not going to have a great experience. It's probably going to cost you more than you thought on the phone when they first told you. And you're better off to find a veterinarian that you can know, that truly cares, that you can establish an actual relationship with, and then maybe get Trupanion insurance so you don't have to
I think that's a good idea.
Yeah. Kind of a twist again on kind of a similar topic. So a lot of the large companies like Zoetis or Merck, or all these companies that make a lot of our products like vaccines, heartworm prevention. I have heard, I'm not a business owner, hopefully someday, but they comparing a private practice to a corporate, say a Banfield or an SVP or an NVA. These larger corporations that can buy stuff in bigger bulk have actually been getting better bargains on a lot of products than our private single practitioners.
Yes.
What is your opinion on that? And have you ever had experienced this? Or
absolutely, it is true. Just like anything, you go to Costco and you buy 105 packages of X, you're going to get it cheaper than if you go to the 7-Eleven and buy 2 packages.
Right.
I think it's more of that concept. I think that we do have some veterinary purchasing organizations that we work with that kind of amalgamates everybody together and gives us some purchasing power. I do think that helps a lot. But I think if you're good at what you do and you're a strong ethical person with, really focus on the heart of the people and the pet that you're dealing with, the difference in price between what your quote unquote competitors can have and what you can have it kind of dissipates, because the vast majority of people are not looking for the lowest price.
Yeah, that's true.
They're looking for the best relationship with someone that they can depend upon and someone that they can trust and that will work hard to do their best to make it affordable in different ways. Most people are just not looking for the lowest dollar. They're just not, because they care about their pet, and you get what you pay for a lot of times.
Yeah, 100%.
Listen to this. I did an analysis on my business, and there's about 20 clients that produce about most of my revenue.
Yes, that's the statistic.
It's the craziest thing.
Yep.
And then someone like the worst clients take a lot of your time, and there's just nothing but problems.
Nothing, yeah.
So sometimes that's what you're saying. You want to focus on the best clients, the ones you like the most.
That you can have a relationship. We didn't go to veterinary medicine. We didn't become a veterinarian to be some cog in a chain, to just be bringing in money for a corporation. Like, none of us thought about that. Every single one of us went into veterinary medicine because we have a real passion for it. I mean, you and I are sitting here at 7:00 at night still wearing our scrubs. I mean, like,
so it was my day off.
Yeah.
This is how you dress all day.
Yes. And so I think that there's a lot of really good veterinarians out there. I think corporate medicine is what it is. I don't worry about it too much, to be honest.
And we were talking about mental health and the crisis. And it's just when you work in these jobs that you have to stay late and you get home late and you never see your family and you're just like worn out. Yeah. That's a problem too.
Definitely can be.
That's a problem.
As a mom, how did you feel that owning a business and being a mom worked for you?
Yeah, so it was tough, but one of the biggest reasons I chose to own a business is because I was a single mom and I had a little girl, and you drop off to school in the morning and then school gets done at 2:30. No veterinarian gets done at 2:30.
No vet's done at 2:30.
So, we're not done until 6 or 7 o'clock at night. So it allowed me as a practice owner, I would put a little gap in the day. I'd get my car, drive the 30 minutes, go to school, pick her up, wait 30 minutes, and then drive the other 30 minutes back, and then restart appointments at 4 o'clock and go until we're done. So it made for extensively long days. But what else was I going to do? You can't leave your kid on the curbside.
Yeah.
So she would come to school, come back to work with me, and use up all my vet wrap and be bandaging herself, walking into the exam
having
room.
fun in the clinic.
Out.
You needed to be the boss, so the boss would let you go get your child.
I did exactly. I couldn't ask someone else to do that, so I had to be able to orchestrate it that way.
Yeah, that's awesome.
There's some clinics don't even want you to have lunch. They're like, we're gonna give you 30 minutes to eat.
I can't even heat up my food, and check my phone in that 30-minute period because I'm calling people back.
When I did relief, I'll walk out of there. You don't want to give me lunch? What is this? Communist Cuba?
Oh my gosh. Look, when my daughter was little, the vast majority of support staff are females also.
Yeah.
And they're the first person that get called for the kids. I hate to say it, but the dads are not getting called at work as often. The moms are getting called. And I would tell my staff, is like, you need to earn the money. You can afford to take a day off, not come in when your kid is sick. Like, you guys need to earn the money. I need you here. And your kid can just as easily lay on this nice cot here with their iPad and stay with us in the office as they can stay at home in bed where you don't make money all day long. One day, we had 12 kids in the hospital. And, you know, we all came to work, all the moms, and, you know, we kept them busy all day long. And they were in and out of the kennels and who knows what else they were doing. Like, I cannot tell you how much equipment they go through and just do stuff. But they were safe. They were looked after. The younger mothers still got to get paid for the day. And it just taught us a lot more about tenacity. Like,
you should do a daycare.
It was like
put the kids in the cages.
I have some pictures. I have some pictures.
Everybody does that. They put kids in cages.
Is that what you do when you're mad at your kids?
Yeah. I have a picture of my daughter when I worked for Banfield. I'm not sure how I got her take her to work at Banfield. I have a picture of her in a cage at like 4 years of age with a bulldog, a random bulldog, English bulldog. I have no idea who it is. I was like, what was I thinking?
Hopefully that bulldog was agreeable.
Yeah. And I actually had my daughter, I worked at a shelter, my daughter worked at a shelter, and she had to come with me a lot too. And I was doing an emergency surgery, and this dog came in and was giving birth, and there was no one to help. There was nobody. My daughter was 6, and she came out. She said, "Mom, something's coming out of the." And I said to her, "That is one of the babies. It's coming out in a sack. You need to help the mom get it out. You need to open up the sack." She's 6. I'm elbows deep in this big pine matrix surgery. She goes, "How am I supposed to do that?" I was like, "No time for questions." I sent her back there. She delivered 8 puppies.
Wow.
Helped the mom, did all that stuff. I mean, it's just, again, you one foot in front of the other. Like, you just have to do what you have to do.
Yeah.
You know, she thought it was cool at the end of the day. She was
she was probably so proud of herself.
Me, I did not feel like a good mom. But I was like, you got to do what you got to do. Keep rolling.
Do you recommend being a business owner?
I recommend being a business owner as long as you're a person that won't ever give up.
Awesome. That's a great way to end it. Heck yeah. All right.
Thanks for watching. Thank you, Dr. Kaiser, for all your information.
Thank you.
And spay and neuter and vaccinate. We'll see you next time.
Bye.